Hi, my name is Ashley Penfield, and this is my further scan in bone cancer. Bone cancer is a rare type of cancer. There's only about 2,300 new cases of primary bone cancer that are diagnosed in the United States each year. It is rare, but it can occur in any part of the bone. It occurs whenever a cell continuously grows. As with other cancers, there's no one cause of bone cancer. In general, cancers arise when normal cell growth and proliferation is disrupted, allowing the abnormal cells to divide and grow uncontrollably. A number of hereditary and environmental factors are likely involved in the development of bone cancers. Bone cancer is a lot like any other cancer. It's a disease that spreads all throughout the body. Bone cancer is a disease that can get into the bloodstream. It can spread to your lungs, and it can eventually kill you. A lot of the times when cancer is detected in bone, it most often has started in another organ or somewhere else and has spread to the bones. Breast and prostate and lung cancers are among the types of cancers that are commonly spread to the bone in their advanced stages. The most common symptom for bone cancer is pain. Whenever you are starting to get bone cancer, you may have a few symptoms, just ever so often you may hurt, like say your bone cancer is in your leg and you're walking around and you're on your leg quite often, and when you are, you may experience a little swelling right there, next to your shin, and maybe a little pain. And you don't think anything about it at first, but over the time it increasingly, worsens. That's when the later stages are coming. Not all bone cancers cause pain, but the persistent or unusual swelling around a bone is a symptom caused by bone cancer. It's important to see a doctor if you're experiencing any of these symptoms that I've discussed. Although bone cancer is rare, it's actually very aggressive. It spreads quickly. Whenever you start to experience these symptoms, you want to make sure you go get it checked out right away, because you don't want to let it spread. It usually affects the people that have harmed their body by smoking, drinking, or, if you have a severe injury to that bone, then eventually you can actually have bone cancer in that bone. There are 4 different types of bone cancers. Bone cancers are common in children and younger adults, more so than in older people. Osteosarcoma and Ewing-sarcoma are 2 types of bone cancer, and they're the most common. They mainly occur in children and young adults. Chondrosarcoma and chordoma are also 2 types of bone cancer. Chondrosarcoma is cancer of the cartilage, and it's most common in adults. Chordoma is a type of cancer that starts in the lower spinal cord. Chordoma is a cancer that can actually paralyze you with it, affecting your lower spinal cord. It can cause a whole lot of problems, and it's hard to treat. Bone cancer is diagnosed by taking x-rays and bone scans, CAT scans, and MRIs. Occasionally, a mass, a swelling, or lump is felt around the area of a bone cancer. Bone fractures can also occur at the site of bone cancer because the underlying bone structure has weakened. A lot of times people will go in, with a bone fracture, thinking it was from a fall or something like that, but it's actually the effect of bone cancer. There are a few different types of tactics used to treat bone cancer. Surgery is usually the way that most people go, because it is the most effective way to get rid of the tumor caused by cancer. And you want to do the most aggressive treatment for bone cancer, because the longer you have it, the more it spreads, and it can eventually kill you. Chemotherapy and radiotherapy and cryosurgery can also be used to treat bone cancer, but they're usually only used in the beginning stages of bone cancer. Bone cancer may be rare, but it isn't something to joke around about. There are people that get it, and you may think that you aren't someone that will, but everybody's got a chance at getting it. If you experience any weird symptoms or unusual sensations, go to the doctor to have it seen about, just in case. You're not the only one that can be affected by bone cancer. Your family is actually affected by it as well, because whenever a person is diagnosed with bone cancer, it usually, might depress someone, because it's very upsetting to realize that you have bone cancer. But also, over time, it starts messing with your body, and you can go downhill fast because it is so aggressive. I recommend, if you have any symptoms or anything like that, or know of anyone that does, to have it seen about, because bone cancer may be rare, but it can happen to you.